Hello, I'm Dr. Teymoorian. In this video, we'll talk about what you can expect before and during eye surgery. We encourage you also to watch our separate video on what to expect after surgery, which includes what limitations in your activity you should observe and what rare warning signs of trouble you should report to us right away. There's a lot of information here, so you may want to take notes and watch this video more than once. 1 or more weeks before some surgeries, like cataract surgery, you may have a preoperative visit to our office to perform measurements on your eye. If you wear soft contact lenses, please leave them out at least 7 days before these measurements. For gas permeable or hard contact lenses, leave them out at least 14 days before your measurements. You can put them back in after your measurements and wear them anytime up to 24 hours before surgery. 2 or 3 days before surgery, one of our staff will be calling you to let you know exactly what time to be at the surgery center on the day of your procedure. That call is also a perfect time to ask any last-minute questions you may have. We recommend watching this video again around the same time so the information is fresh in your mind. For some procedures, we recommend starting eye drops a few days before surgery, so be sure to fill your prescriptions in advance. Check your preoperative instructions to see if your procedure requires drops before surgery. If you're experienced in taking eye drops, we also recommend watching our 3-minute video on our website on how to take your eye drops. You're sure to learn some tips that you'll use. If you normally take glaucoma drops, you can continue these drops as well, right up to and including the day of your surgery. You'll also continue these after surgery without interruption. If you take blood thinners for cataract surgery, it is not always necessary to stop taking them, but with other procedures like eyelid surgery, our doctors may make specific recommendations. See your preoperative instruction page to find out what should be done for your procedure. If you're wearing any type of contact lenses, please leave them out at least 24 hours before surgery. On the morning of surgery, do not eat anything for 6 hours before your procedure and do not drink anything for 4 hours before your procedure. You can take your usual medications with small sips of water except diabetic medication and water pills or diuretics. With diabetic medications and diuretics, please bring these medications with you to take after surgery. Please leave all jewelry and other valuables at home and don't wear any makeup on the day of surgery. Please wear comfortable clothing. A short-sleeved, button-down shirt or other loose-fitting shirt makes it easiest for us to monitor your heart and blood pressure. We perform most procedures in our state-of-the-art, Medicare-certified surgery center rather than a hospital. You should plan on being there for a total of 1.5 to 2 hours. When you arrive, our nurses will help you onto the gurney and you'll be wearing your own clothing throughout the procedure. We give you an IV with medications to really relax your nerves, and the nurses will put in a number of eye drops to prepare your eye for surgery. You may or may not fall asleep, but we will absolutely make sure you're comfortable and not nervous as we move you into the procedure room. Most eye procedures take less than 20 minutes and are painless. If you're awake, you may see bright but not uncomfortable light. Many people see moving colors like a kaleidoscope, and you may be awake enough to talk with us to tell us how you're doing. If you're nervous or uncomfortable, we want you to tell us, and we want you to be comfortable. Otherwise, it is best to remain quiet and relaxed. After the procedure, you'll be on your way to recovery area where we'll slowly help you up. Shortly after that, you'll be helped to your car and you'll be on your way home with the person driving you. Everyone who is having surgery needs a driver to get home. The best choice is a friend or a relative member. Unfortunately, taxis are not allowed for transportation home. If you need help finding a ride, let your surgical counselor know. We hope this information is useful to you as you prepare for surgery. To learn what you should and shouldn't do after surgery, please watch our next video on that topic. Meanwhile, if you have any questions, please feel free to let our staff know. I'm Dr. Teymoorian, and thank you again for watching.